Hi, my name is Frederick Isasi. I'm the Executive Director of Families USA. We've been around for almost 40 years. We're a nonpartisan think tank and advocacy group. We fight to ensure the best health and healthcare are equally accessible and affordable to all in our nation.
I'm Mark McClellan. I'm the director of Duke University's Margolis Center for Health Policy, which is a university-wide program, also has offices in Washington, D.C., working on current healthcare reform issues. I'm also a former administrator of the Centers for Medicare and Medicaid Services.
Hi, I'm Emily Barson, Executive Director of United States of Care, a nonprofit organization founded in 2018 by a diverse group of leaders, advocates, regular people, providers, entrepreneurs, experts, community leaders, and more. Our mission is to ensure that every single American has access to quality, affordable health care, regardless of health status, social need, or income. And since the pandemic began, we've shifted our resources to fully supporting COVID-19 response efforts. We recognize it's critical that we not only provide immediate support to the urgent needs of the crisis, but that we do the work to make sure we come out of the experience stronger.
The COVID crisis has laid bare two urgent problems. First, we aren't effectively marshaling our very substantial healthcare resources to control the pandemic. Second, our whole healthcare system is based around face-to-face care and medical procedures. That's one of the main reasons why we are not ready for COVID-19. And that's why the Duke Margolis Center for Health Policy, Families USA, and the United States of Care, along with supporting organizations for employers, consumers, providers, healthcare systems, and former CMS administrators, are joining forces to send a strong message to Congress to ensure additional support to healthcare providers being negotiated in Congress right now enables providers to effectively respond to COVID-19 and embeds more resilience into the healthcare system as a whole, so we are better prepared for future challenges.
The pandemic has sent shockwaves throughout our healthcare system, forcing healthcare providers to rearrange staffing, modify facilities, rely more heavily on telehealth and community-based care, and reimagine the best way to support their patients, all while facing significant, persistent revenue shortfalls. Physician practices have seen declines of up to 50% in service volume, and hospitals are projected to lose at least $323 billion in 2020.
And that's a real challenge in the current pandemic. Because of these revenue shortfalls, physician offices, other medical practices, hospitals have had to worry about cutting back on staff, cutting back on activities at a time when they're being called to take new actions to help contain this unprecedented pandemic. And these kinds of conflicts speak to the lack of resources that providers have to care for people and implement the important COVID-19 response strategies that we need to help detect new cases, to help contain them in the community, to help work with our public health response to get through the pandemic. Some of the hardest hit providers in this pandemic have been those serving the people who need the most help right now. Communities that have lower incomes, that have been harder hit by COVID-19 cases, people of color, all of them really need a response together from our healthcare and public health systems.
This is a problem largely created by a healthcare system that is based on fee-for-service payment structures, which reward providers to focus on performing units of care rather than thinking holistically about how to either keep people healthy or get them healthy in the most effective way possible. In the midst of this national crisis, provider organizations are finding that fee-for-service offers no payment for implementing necessary COVID-19 detection and containment strategies or for keeping the community in good health. Making matters even worse, there is no financial backstop for these providers. So when utilization drops, many practices are being forced to close their doors, which further prevents families from being able to access critical healthcare services.
We are seeing alternatives in some parts of our country where healthcare providers that have moved away from fee-for-service and into so-called value-based care and value-based payment models are doing better. These are approaches like advanced medical homes or advanced accountable care organizations where much more of the payments are tied to the people and to giving them the services they need rather than to specific traditional healthcare services. And for the organizations that have already moved into these models, the response to the pandemic has been quite different. First of all, they haven't faced substantial declines in revenues. Second, they've had steps in place like already having team-based virtual care models to help reach out and engage their patients, reduce risks, and implement some of the new models of care that are needed. That kind of approach is not easy for every healthcare organization to adopt quickly, but we've seen in the pandemic that it can really make a difference. And what we'd like to see is more steps to help other healthcare providers move in the same direction.
Providers using these alternative payment models have been able to quickly implement an effective pandemic response, while providers relying on fee-for-service have had to rely on outdated rules and dramatic payment changes in order to move forward with the obvious and necessary reforms.
In a moment when our nation needs access to healthcare most, we must ensure healthcare providers have the financial resources needed to meet their patients' needs during the remainder of the health emergency and long into the future. Our proposal makes 4 key recommendations to Congress.
First one is our Relief, Response, and Resiliency Program. And this is intended to give healthcare providers the assistance they need to get out of the financial shortfalls they're facing, but do it in a way that helps them respond with public health and come out of the pandemic stronger than before. First of all, the relief payments would provide immediate help to providers to address their financial shortfalls, building on previous programs like the Paycheck Protection Program and the Provider Relief Fund. These funding sources are needed to help the providers with their immediate shortfalls. But we also want to go beyond that with response and resilience. Response payments are linked to the collaborations with public health that are needed right now to help contain the pandemic. This includes sharing data between healthcare organizations, laboratories, and public health. And then in terms of resiliency, that's a set of payments that would be linked to transitioning into one of these advanced alternative payment models over time, either in Medicare or with private health insurers or in Medicaid programs. And second, we're asking Congress to expand telehealth coverage to include audio-visual, audio-only service, and remote monitoring with appropriate payment rates and flexibility to make adjustments as needed over time. We want to ensure that these expanded telehealth payments that have been an important piece of the pandemic response can continue.
The third recommendation is asking Congress to expand site-neutral payments for services delivered in home or community-based settings as alternatives to facility-based settings, including drug infusion, advanced rehabilitation services, and intensive hospital-at-home services. It's important that these payments be on par with those for in-person ambulatory or outpatient services, with special attention to ensuring access to care in underserved urban and rural communities.
We're asking Congress to ensure that secure healthcare utilization data is available to patients, their providers, and healthcare experts during and after this pandemic. More specifically, we're urging Congress to establish a national, non-governmental, nonprofit transparency organization to provide necessary data to support assessment of care quality, cost, and disparities across the nation in healthcare settings. This is a critical step in being able to ensure healthcare providers have the access to timely information on healthcare utilization and payment for COVID-19 related services and other services to inform our pandemic response for all people, including for communities of color, low-income and rural communities, and others that have been disproportionately impacted by the pandemic. This recommendation is strongly bipartisan and mirrors, for example, Section 303 of the Lower Healthcare Cost Act, which was passed with strong bipartisan support by the Senate Health, Education, Labor, and Pensions Committee in 2019. So taken together, these 4 recommendations will provide a secure pathway forward for the backbone of our healthcare system, primary care providers, specialists, community health centers, and hospitals, who must adapt to provide care for the remainder of the COVID-19 pandemic and long into our nation's future.
To get through this pandemic, we need our healthcare providers to be strong and resilient.
And I would just add, we know what people want from the healthcare system is the assurance that it's going to be there when they need it, now and after the pandemic. And that by rewarding value instead of volume, medical professionals can practice medicine the way they want to, focusing on keeping people healthy rather than just treating people when they're sick. And people can get more attentive care and higher value when they need it. So we think this proposal will move us towards that vision of a more equitable healthcare system for everyone.
We urge Congress to include our recommendations in the next COVID-19 relief package, and we stand ready to support Congress in these efforts.